Health Nuts, episode 15.
You're listening to Health Nuts with Dr. Chris Carr. Making lifestyle changes is hard for many people, and not knowing what to do or how to do it makes the task all the more daunting. Here at Health Nuts, we focus on helping you live a fuller life by discussing everyday health issues and exploring breakthrough solutions on how to overcome them. And now, here's your host, Dr. Chris Carr.
Welcome back to another episode of Health Nuts. I'm your host, Dr. Chris Carr, and today I am so excited to have our very special guest, and that is Dr. Ben Rall. Dr. Ben has helped me personally over the years through hours of training and pouring into me about what being not only a great doctor is all about, but more importantly, a better person, both at home and in the community. His love for not only chiropractic, but for the service of others is what truly makes him so special. His clinic and practice success have allowed him to help manage over 450 chiropractic clinics across the globe. He has helped open clinics in Africa, traveled around the world, teaching chiropractic and delivering care, and even provide care for Olympic athletes, including the 2012 Games in London. He currently resides in Orlando with his beautiful wife, Megan, and two subluxation-free children, Jack and Grace. His latest book, Cooperative Wellness, How to Achieve Wellness and Be Part of the Healthcare Solution. It's easier than you think, is what the topic will be about today. So without further ado, Dr. Ben, welcome, my friend. It's good to see you again.
Dr. Chris, thanks for having me. I wasn't sure at some point if you were talking about me still, but then I heard my wife and my kid's name, so you must have been talking about me. So it's an honor to be on this show and to be sharing with your audience and your people that are following and listening to you as you help them achieve health. So yeah, excited about this. How do you want to start?
That's formal. Yeah, that's the formal intro of you. But so something else about you we don't know. So it's been probably about 2 years since I last saw you. So just a little formal. What's been going on?
Well, we've when I was running the practice myself before back in South Dakota, and after I relocated down to Orlando and was working with other doctors, and then I actually spent some time at Life University, which is the largest, of course, as you would know, the largest chiropractic college in the world, and it's in Atlanta, Georgia. And I went up there and I helped work with the president there and the executive team to build a clinical system for them for the public. And this is part of the evolution of the call that this call today, Chris, which is, people want this model of care, and they want it from birth to death, if you will. They want to understand, how do I engage my family in this? We all know that chiropractic and natural, vitalistic type of healthcare, many of us understand, and probably certainly the people that are watching this understand the value of that. But a lot of people don't know how to engage early on. They understand when I have a problem, a pain, a symptom, a diagnosis, and take that natural approach. And so what we did there, spent about a year doing that, was really flush out a vitalistic model of care that really a person can step into, and that can be their healthcare model. I know sometimes, especially for patients, if you're listening, as those that are listening, it's sometimes you feel like you're straddling this fence. It's kind of like it can almost be confusing. Like, what am I doing, right? Am I natural? Am I on drugs? How do I do this? And so we really wanted to give them that complete model. But it starts with one thing, and this is really my passion and my heart. That's one thing that hasn't changed, even though it's been a while since we caught up. The foundation of this is that we have to understand, it doesn't matter if you're a doctor, a patient, 100 years old, 10 years old, we have to understand that our bodies, there's really no simple way of saying this, or there's really only a simple way of saying this. Your body, my body, my children's bodies, your bodies, they're all designed to heal. Now, it's not just a kind of a bumper sticker statement, or it's not even actually a philosophy. It's really just physiology. Your body, my body, is designed to heal. Once we understand that reality, once we understand that truth, if you will, that will significantly affect how we approach our health. Okay? And so it's doctors like you that are out there saying, let's give you the tools and the resources so you can now apply that to your life and then have the results of that. So that's what we're up to. We have a clinic again down in Florida, in Orlando area, Achieve Wellness, and we're doing what you're doing, serving people, loving on them, and teaching them about how the body's designed to heal.
And I know your backstory because I know you for long, and you've shared it with me and you shared with others, and it's a pretty powerful backstory. You mind just kind of telling the audience kind of where you came from and kind of the balance, because you were once well on your way as you were where you served the games in the Olympic Games, you almost went down that route.
Yeah, it's hard to. It's almost getting to that point. I'm getting a little older now to remember that, and every time I tell the story, I have to add years to it. But yeah, I was training for the '96 Olympics. That was my goal. That was my dream. And believe it or not, I was as a boxer. That was my sport. I started when I was about 9 years old, and was able to have some success. And so it was time for the box offs, and that's where the top people in the nation get together and fight for the spot on the team. And that was my whole dream, my whole goal. So I'm training for that, and all of a sudden I say all of a sudden, but before I understood health, I became sick. And I do what you do. You call your mom and you say, I'm sick. What do I do? I'm 19 years old at the time, and she said, go to the doctor. So I went to the doctor, and they did a scope where they went down this way, and they did a scope where they went up the other way. And I had precancerous lesions all throughout my digestive system. And when you're 19 and you're told that, I don't care how old you are, you're concerned. So I said, well, what do I do? And, this won't probably surprise some of you, but the medical approach was simply to throw some drugs at it. So they gave me 2 medications. The medications shut down my digestive system. I went from 165 pounds to 245 pounds.
Wow.
I got kicked out of the Olympic training program. I don't know if you know much about boxing, but there's weight classes. And when you go from light heavyweight to super heavyweight, that's a problem. Okay. And so I suffered like that for 3.5 years. Pardon my language, but I was sick, fat, and depressed. And I didn't know what to do. I'd go in every 6 months and get scans redone. My scans were either getting worse or staying the same. Nothing was getting better. I'm having, the sequelae. I'm having all the side effects. My face is breaking out. I'm getting sick more often. I just don't feel good. I'm tired. All these things. Well, then lo and behold, I ended up meeting a chiropractor. Now, I'd gone to chiropractors growing up, but the type of chiropractors I had seen hadn't really sat me down and explained how the body heals and functions. It was more maybe more your typical, get your back cracked, maybe feel better. And I'm not entirely opposed to that. Well, I shouldn't say that. I am. I believe the job of a doctor is to educate their people. I don't care what kind of doctor you are. I think our primary job is teacher, and we should explain to people why we're doing that. So I finally met a doctor that did that. And I know this is going to sound embarrassingly simple, and I'm embarrassed to almost say I didn't understand this, but he sat me down and he said, and now I'm 21, 22 at this time, and he said, Ben, I don't think that your body just forgot how to digest food when you were 19. And I don't think that the problem is I don't think the cause of that is a deficiency in medication. And I still, every time I think about that, it sounds so simple, but it transformed my mind. And he began a process of, he ran tests much like you and myself do in our offices, found out very specifically where the problem was. It doesn't always work this way, but this is what happened in my case. I got off the medications I've been taking every single day, 2 medications several times a day that I was taking. If I didn't, I had extreme symptoms. I got off of those drugs in 1 week. I lost 67 pounds in 4 months. It changed my life. I got my life back, saved my life. Matter of fact, one of the medications that I was on has been pulled from the market because it's now admitted that they killed 32,000 people a year with that medication. Okay, wow. That I was on, I was expected to be on for the rest of my life. Now, fast forward a little further, 3 months later, I go in, get my follow-up scan done, and now for the first time in 3.5 years, all my lesions are gone. Now, some people hear that story and they think that's a miracle. They say, oh, thank goodness. And it is, and I am grateful, don't misunderstand me. But let me be very clear, it's not a miracle. It is not a miracle. It is amazing. It is incredible. It's awesome, but it is not a miracle. Okay, because a miracle would be something that you can't explain. All right? This is very explainable. When you remove the interference to my body, when you got off the medications and you got to the cause of the problem, my body healed the way it was designed to. So when that happened to me, I decided, no surprise here, I decided to be a chiropractor. And the next thing that happened to me, doctor, was I was in the, like when we're in school and we do cadaver labs. We begin cadaver labs very, very early. And we went in and I remember that day, I get goosebumps every time I share this, and we opened up the human body. And I literally was brought to my knees when I realized the intricacy of the human body, the design of the human body. And I realized as a doctor, the best, I don't care again what kind of doctor you are, the absolute best, most powerful thing that any of us could do for any patient would be to work with that design, right? Remove interference and or provide that, what it needs so it can function the way it's designed to. So that became my life mission. That became my purpose. That's what I still do. But you have to first understand that your body's designed to heal. Then all of the rest of it, if you understand that your body's designed to heal, chiropractic makes a lot more sense. if you understand the body's designed to heal, the nutrition put in your body begins to make a lot more sense. And then alternatively, the other way around, drugs make no sense outside of emergency situations. It doesn't make any sense. Why would I medicate something if that's not going to be the cause of the problem? Okay. And so, obviously I get a little bit worked up about it, but this saved my life 20 years ago, right? I wouldn't likely even be sitting here today. I certainly wouldn't be healthy. I wouldn't have 2 children. I wouldn't be able to, do the things that we do at the capacity that we do them if I didn't have my health to do that. And so I just believe that everybody deserves that opportunity. So that's a long answer to your question there, Doc. But that's what got me here today.
Well, yeah, it's an appropriate topic because it's your backstory, and who knows if you would have made a left instead of a right, where you would have ended up.
Yeah.
So where I want to go with it, because your book, when it talks about cooperative wellness, we talk about, a lot of times for a lot of people out there, they're working the 9 to 5, they're in that office setting, and a lot of times they work through their lunch break, they might have to go home and get the kids, and their health ends up going on the back burner, and they end up getting sick years and years down the road, or they're doing we were talking about earlier, they're taking X, Y, and Z med to cover up that warning sign that they're getting. So how does that relate with your book? And kind of, if you can go into some detail about what that's all about.
Yeah. So thank you, Doc. You're right. I mean, when America is unique in a couple of in many ways, but one of the ways that we're unique is that healthcare is provided, primarily through employers in the United States, meaning your employee, if you're work for somebody, your employer likely pays some portion of your health insurance and so on. And obviously the debate is raging right now, and this isn't a political conversation, but it creates a unique situation in that the way we think about our health is often through our employer, and then it relates to our healthcare benefits. Okay. And so many of you, I'll tell you what everybody knows when it comes to corporate health is this. They all know that their premiums go up every year, right? They all know that they're frustrated with that. Their deductibles go up, this type of thing. So as I began to work through this and trying to find a way to get access to people, because what I found is people weren't really resistant to, I mean, sure, there's some people that, are not interested in taking care of their lifestyle. I believe that can still be transformed, but most people that I meet want to do the right thing regarding their health, right? They do. And so I wanted to find a way to get them more access. And like you said, instead of just waiting for them to end up sick, suffering, and dying, that's what drove me into the community back when I was in practice in the Midwest, which was I got sick and tired of waiting for people to get sick. Right? It made no sense to me. It's why we saw a lot of families, a lot of children. I'm not going to wait for their 5-year-old son to be the guy with headaches for 15 years and on 3 medications and then, told he has to be on those for the rest of his life. So that's why we would go out in the community and meet those people right away, or the best that we could. So what happened, some of you probably heard this and certainly probably educated through Dr. Chris, but, they call it, like, for example, one of the things they say, sitting is the new smoking, right? You kind of hear that term, right? And with texting and computers and sedentary lifestyles, right now the statistics vary, but conservatively, 75% of disease is related directly to lifestyle. I have numbers that say it's closer to 85 or 90%.
Right.
Whichever way you want to use that, that's a lot. Like, I don't care which way you want to slice that, that's a lot. And so for all of us, myself included, our lifestyle, the way we live our life is directly impacting our health. And if we're sitting at computers all day long, as an example, a micro trauma, generally stressed out, generally eating poor, generally living off of coffee and Monster energy drinks, and we're what we don't realize is we're actually literally building disease in our bodies. I've seen some studies fairly recently, again, talking about cancer and the amount of time cancer grows. I just saw a new study that says your body has to have your body, this is important for somebody that's listening. Your body has to essentially be in a cancerous state, okay, for 17 years for cancer to develop, to get to the diagnosable point. So you're a 50-year-old. So when you were 37, right, you're sitting in or whatever that number is, 33, I'm getting my numbers mixed up. You're 33 years old. You're sitting there, cancer's starting then, but that's the 50-year-old that goes in one day at lunch and finds out bad news, right? So as vitalistic doctors, as wellness doctors, as preventive doctors like yourself, and for the patients listening, sometimes this is what gets a little crazy. We sometimes seem like we're the Chicken Little, the sky is falling, right? We come into the 33-year-old that, is skinny and fit and, whatever, and we say, hey, you might be setting yourself up for cancer, right? And they're like, what do you mean? I can run a mile and I love to cross, something like that, right? And those things are important. Don't misunderstand me. But I'm saying our job as doctors is to say, if I know the path you're on, I'm a parent, you're a parent, many of you listening are probably parents. If my 10-year-old daughter started smoking cigarettes, right? Now I would say, no big deal, right? I mean, no, I'd be concerned. I'm not concerned. I'd be concerned for a lot of reasons. My 10-year-old smoking is a little weird, all right? But I'd be concerned because of what that could do to her, right? I mean, I don't expect her to drop dead that afternoon, right? But I realize that what that's causing in her body. So when we look at the lifestyle and primarily through the employer. So we've set up relationships in the book. It's primarily about helping people understand how do they engage in that vitalistic model of care in their life, because different than the medical model, which is, wait, reactive, right? Wait till you get sick, maybe go in once a year and get a blood test done or a physical, which I'm not even going to get into that discussion. We could, but that's a very poor way of managing your health, right? If your totality of your health is what my blood said one day, one time a year, I'm telling you, you are missing the boat. You are simply waiting for disease to get bad enough to be picked up on some blood test at one moment in time and saying, oh, now I'm sick, right? Where healthcare is rather something you do on a daily basis. And so as an employee, okay, it's important, whether you're an employee in my mind is anybody. I mean, whether you're a stay-at-home mom or a soccer coach or a CEO, you need your health to do that job. And that needs to be done on a daily basis. So it includes many of the things you teach, right? Through nutrition, through fitness, through toxicity or detox, through spine and nerve system, brain-body communication, and mindset. And that's, mindset for me, Doc, and probably for you. When I say mindset, I'm not talking about, having a good attitude and saying your affirmations in the morning. Those things aren't bad or evil. I am saying, though, that you have to have an understanding that your body's designed to heal. Because if you know that to be true, then you're going to want to get up and move, right? If you know that to be true, you're going to be thinking about when you're at that vending machine and it's, Doritos, Cheetos, and a Mountain Dew, it just doesn't make sense. I remember I just did a talk last week on some nutrition stuff, and I said, if you went to the gas station and you filled your car up with gas, and then your car said, hey, if cars could talk, right? And if your car said, hey, I need to rest for about an hour before I can drive, since we just got gas. Well, no, you fill up because you're fueling it to go do more of what it's designed to do. So if with your body, when you get done eating, right? So if this is you listening and you get done with lunch and you need a nap, I'm going to suggest to you didn't just eat food, right? Whatever you just put in your body may have calories and maybe had some things in it, but you didn't give it food. When you eat, you should feel energized, right? When you yourself, myself, our days, we're designed to thrive. And I'm not trying to, again, get motivational here, but I'm saying this simply to say, if you're not having that, there's a reason for that. It's not a deficiency in a drug, okay? And there's ways you can, and there's things you can do very simply. I joke about this sometimes, Doc, and you probably do too, which is the only reason my office really exists is because that's the place that I deliver the adjustment. All the rest of a vitalistic lifestyle is you do it on your own, right? I don't come home and cook for you. I'm not going to come in and tuck you in at night and say prayers with you, right? I'm not going to per se come into your front yard and exercise with you. That's not what we're going to do. You can do all of that on your own. You're an adult, okay? However, the chiropractic adjustments, communication from brain to the body, I can't send that home to you in a pill, right? We have to do that. We have to lay our hands on you. And so that's what our office is. So this is encouraging to people because I want them to feel empowered and say, hey, just like I would encourage a person, don't hand your health over to a medical doctor or a pharmacy or an insurance card or a hospital. Don't hand your health over to me, all right? Your health is your health. And it's those decisions you're making on a daily basis. But it starts with the fact that your decisions matter. You've seen this study. I use it all the time. 90%, and you know this, but so right now, 5% of the population in the United States of America, we consume over 75% of all the medications. We're currently ranked 37th by the World Health Organization. The World Health in healthcare. World Health Organization also says that over 90% of medical procedures that are currently done do not actually work. Okay, I'm somewhat paraphrasing that statement. World Health Organization on record saying that 90% of the procedures that are done in healthcare in the United States do not get to the cause of the problem. Okay? That's major cause for concern as a consumer. Okay, so we have to be. And then the real crazy news this week that came out, Doc, and probably saw, of course, front page news. Number one cause of death right now for people under the age of 50 in the United States of America is prescription drug overdose. Right now, there's a caveat to that, and I want people to hear this. What they often call overdose is not an overdose, folks. You need to hear this, all right? It's not an overdose in what you're thinking. It's not little Ricky getting in the cupboard and eating drugs, okay? It's them taking prescribed medications as prescribed and it killing them, okay? Now, the medical mindset says that that was an overdose. It wasn't an overdose. Well, of course it was, right? Because it should have been no dose, okay? But they took it and it killed them. And so we have to wake up to this reality. I know I got a little bit off topic of that, cooperative health or corporate health. But the problem is most of those people that are dying, the 67,000 people, I believe the number was, I would tell you, most of those people were employees, right? And most of those people were taking pain pills because their back hurt from sitting at their desk, right? Or they had headaches or migraines or cervical degeneration in their spine, and they'd gone somewhere and they told them there's nothing they could do, and they went to their doctor and they said, hey, take this, right? Take this opiate. It will knock the pain away. Take this injection. Take this shot. Now, the point that we have to talk about and why vitalistic approach to healthcare matters, because if you approach your health that way, that doesn't even become an option. Doc, you probably get, I get back pain once in a while. I bend over a lot of people every day, right? Yeah, but I don't ever think, I wonder what I could take for that, right? It doesn't come up in my head, right? Because my approach to health doesn't involve those things, okay? It's the same thing with how we raise our children. So if you're listening to this it doesn't matter who you are listening to this. If you're struggling with your health, the point is, how do I get to the cause of that problem? And let me be clear, I promise you, there is no disease, in the history of humanity that ever was, ever will be, right, that is due to a deficiency in a drug. That's important for you to understand, because if that's the case, then you're not going to look for that as a solution, okay? And then you'll start looking other places, for instance, your office and others. So, as an employee, understand, but let me finish with this statement and we can move on. As an employee, do not expect your employer to, they're not your doctor either, right? A lot of times when we talk about people that are, looking for work, they're like, well, what's the benefit? All right. And we could talk about this. I'm just going to encourage you listening as an employee, your benefits, best case scenario, you want to never have to use your health insurance. Right? I mean, I think that would be all of our goal. Okay. And so, yeah. So for us, as we're sitting there, be careful about how you're navigating that decision. If somebody said to you, all of your, you have no deductible, no copay, all of your quote health care is free, would that make you healthier? No. Right? Because it doesn't have anything to do with the food you're putting in your mouth. That doesn't have anything to do with how you're sleeping. That doesn't have anything to do with your relationships. That doesn't have anything to do with, fitness levels or anything like that. Okay? It might be nice if you fall out of a tree and break your arms, all right? But outside of that, it has nothing to do with health. Okay? And so be careful with that. And, as an employee, and realize, your health care is the choices that you're making every single day. You are the doctor, right? And ultimately the power that is inside of you is the most important aspect of healing, and our job is to work with that, not against that.
So with that being said, what else? So the employee that's working that 9 to 5, what are 3 tips you can give them to take control of their health?
Absolutely. So I happen to, in the work that we do, we work with a lot of businesses, and we're actually the chiropractor for the entire company and their families. And so we work with everything from, construction workers, heavy construction workers that are out in the field, to office jobs and things like that. And probably the number one question I get is how do I eat healthy? And that's an important question, and we do need to think about that. I mean, our bodies are made up of the things that we put in them, so it's a big deal. The first thing I would encourage a person on, it's if I ask somebody, hey, is there 5 things you already know that you could do to be better nutritionally? Almost everybody would say, yeah, I should do this, this, and this. The reason we don't do them is oftentimes because we're human and we have habits. And so the very first thing is, it's going to sound a little bit funny, because you think I'm going to say, hey, you should eat this or don't eat this. And really what I'm going to tell you is, whatever those things you already think you should do, or you already know you should do, they're probably a good idea, and I probably would agree with 95% of what you would all say. I would just encourage you to do it for 7 to 10 to 14 days. The biggest thing that we see happen is it's because of our addiction to refined foods, processed foods, sugars, which cause inflammation, carbohydrates. I mean, we could go into this. I think most people are becoming aware of that, so I don't think I'm going to surprise anybody there. But what happens is, since our bodies are so addicted to them, and we're essentially just sugar burners, when we stop doing that, that first period of time can be pretty tough. And so what we think, here's what happens in our heads. You know, it's like if you haven't worked out and you didn't have any understanding of it, and then you went to the gym and you worked out, the next day or two when you woke up and you were left to your own assessment of that, here's what you'd say. Exercise is the stupidest thing I've ever heard of. It makes you hurt. I feel worse than I did before, right? So what happens to us is we want to lose some weight. We want to feel better. We want to get rid of our headaches. So we say, you know what? We listen to, you know, a show like this. We Google something and we say, you know, I'm gonna stop eating sugar, right? And so we stop having 4 Mountain Dews in the morning and we throw away the energy drinks or something. And you know, those first few days are pretty tough. And then what happens is we just say, oh, the heck with it. I feel like crap. I got a busy day. And we fall back into those old habits. And so my first thing is simply encouragement. Okay, it's simply encouragement. You can do it. It's not easy. It's simply creating a new habit. Okay, physiologically now, however, I will tell you this. Physiologically now, so these are in a certain order for a reason. So that's number one. Number two, though, is for those people that probably have what most people have, which is essentially an addiction to sugar, carbohydrates inside of their body, I do recommend supplementing. I'm not a big, huge supplement guy. I'm not saying you have to live on a bunch of vitamins, but during this season, it's a really good idea to supplement with healthy fats, okay, omegas. Omega-3s, is you hear about that, fish oil, those types of things. Sure, Doc has them in his office. I have them in my office. Now, you can eat them. Absolutely. They're in, good, healthy nuts, avocados, things like that. I'm not saying that. However, during that time, to offset your addiction to the sugars and help symptomatology-wise, so you're not suffering so much, you want to be taking a lot of omegas during that time. That's the second one. That's part two, okay? It's good fats. Then the third thing, and again, you know this, but I have to explain. I have to say it. I feel like I have to say it. It's movement, okay? There's a lot of studies on this, and it's not that you need the studies, but I think sometimes we downplay. Let me give you an example. If I told you that there was something that you could do as a woman to reduce your chances of breast cancer from 30 to 60%, would you want to know what that is? Of course, right? Yeah. So then if I told you that had to do with being, if you were 15 pounds or more overweight, that increases your chance of breast cancer by that much. Well, sometimes at that moment, you're like, I don't know if I want to know that. Right? Okay, because that's something that I have to do to address that. So the reason I'm saying that is because what I'm going to talk about is you have to move your body. There's just no way around it, folks. Okay, we have to move our body, whether that's a brisk walk over lunch. There is incredible amounts of published research on what a brisk walk 3 to 5 times a week does for your health. If I even went through some of the statistics, you wouldn't believe me. Okay, literally all-cause mortality go down, reduces lung cancer, reduces skin cancer, reduces almost all diabetes issues. I mean, I could literally go on and on and on and on and on. But I don't know what it would take for you to do that. But again, it's the same thing. It's a habit. Okay, there was a study done out of I believe it was Duke, and they were talking particularly about depression and anxiety. And right now, the number one prescribed drug for women between the age of 35 and 50 is antidepressant, anti-anxiety medication. Okay, it's devastating. It's heartbreaking. Matter of fact, I just saw a study the other day, and it also shows that right now in the United States, our suicide rate is the highest that it's ever been in history, percentage-wise. Okay, so even though you saw it as well, so even though we're taking more medications than we've ever taken to quote treat those things, it's obviously not working. And I will very much say, obviously, it is not working. This is not my opinion. This is simply the facts. I understand sometimes they're uncomfortable, but you deserve to know, just like I deserve to know, just like my wife deserves to know, just like you deserve to know. And so we have to look at other ways around it. I am not debating whether a person is depressed or not feeling well. That's not the conversation. I'm simply saying the problem is not that they have a deficiency in a Prozac or Zoloft, okay? So this one particular study actually did control groups, and they compared those people, and they simply exercised, and it wasn't even crazy exercise. It was something everybody on this call could do, and they found out that beat antidepressant medications head to head and worked long term. So when you start to look at things like proper nutrition, proper movement, chiropractic, detox issues, understanding how your body's designed to heal and function. I've had people that just simply knowing that their body's designed to heal is enough to get them out of being depressed. Okay. And so we just have to remember, so those are the three things. You gotta just commit to the facts, right? Give yourself some grace and some time to do that. Supplement with good, healthy fats. Just this day and age, it's a really big deal. And number three is just get out and move. And that can be something as simple as a brisk walk for 30 minutes.
Yeah, I love all those shares and for taking action and being mentally prepared to do it. I just love it. So you have this person, it was a good segue. So you have this person who's, they're down in the dumps. Their health is lost, and they don't know where to go. What do you tell that person who's completely frustrated? They don't know exactly what road to take, and they're struggling. What do you tell the struggling person out there?
Yeah, man, that's a good question. Well, it's an important question is maybe the better way. What's so important to understand about a vitalistic approach to health. Sometimes people say things like this. I don't know what to do. I've been through everything. I've tried everything. Nothing has worked. And then they'll say something, a lot of times when we meet them, they'll say something like, you're my last hope.
Right.
Or sometimes they don't even get to that point. They just have given up. Now, here's what a person really needs to know about this. You need to know, and I want to say this the best way that I can say this. Your absolute single best chance at having the health that you want, need, hope for, all of that, your absolute best chance at that is through a vitalistic model of care. Okay? This is important. The reason that this is important is because it helps you know how to navigate. It helps you know where you're going to find those decisions. Okay? Because if you're straddling the fence, like we talked about a little bit earlier, right? For example, let me give you an analogy. This is hopefully helpful. If I broke my leg and I had no idea about how bones heal, okay? And so I broke my leg. It hurt a lot. I put it in something, a cast, if you will, for 2 weeks. It stopped hurting as much, so I assumed it was healed. Or whatever. So I took the cast off and I went and played basketball. Right, my leg isn't healed yet. I would re-injure it, and then it would hurt, and I would go, oh gosh, I guess it's not healed. So then I'd put the cast back on. I'd do that for a couple of weeks. It would feel better again, and then I would go try to play basketball again, and it would hurt again, and I would re-injure it. And I might come to the wrong conclusion, but based upon the logic in front of me, I might come to the conclusion that apparently my broken leg can't heal. Right? That's not true. It's just that based upon the information that I have at the way I think about that, the way my perspective, my frame of reference, my understanding is limited, and because of that, I'm not able to get those results. So now that person enters into, enter in a person that understands how their body heals, and they walk you through that process. So sometimes left to our own devices, we will come to conclusions that my headaches will never heal. My numbness and tingling can never heal. My energy levels can never come back. My thyroid can never heal. My cholesterol levels can never improve. It doesn't matter. You fill in the blank. It's all physiology. It doesn't matter. It's the same thing. Okay, I don't care what somebody's diagnosed with. I don't care what the label is. I don't care what your disease is. It doesn't matter. It matters, but it doesn't matter in the sense of that, can you heal or not? Okay, and so now, and so whatever you have, the vitalistic approach is the best. Giving the body what it needs, not what you think it needs, not what you kind of want it to need, not what what you feel like eating on Tuesday. Okay, not what your friends are eating, not what your Uncle Ricky, who feels better than you do, eats. You have to find a person that understands what the body needs, like Dr. Chris or myself, or there's thousands of other fantastic, vitalistic, naturally minded doctors. However, let me be clear. Go in and tell your list of symptoms to your local medical doctor, and you'll leave with a bunch of pills. Okay, so you got to be careful where you're going to for that information. So the person that's struggling, you have to know Your body's designed to heal, okay? And your best approach is working vitalistically with your body. Does that mean you'll live forever? Nope. Does that mean that every ache, pain, that you have will go away? Nope. Does that mean that you won't have, a heart attack in a week? Nope. Doesn't mean that, folks. Okay. It means that you have given your body the best chance that it has at having its maximum potential to reach whatever health it is that you're designed to have. Because compared to what? Okay, this is what we always have to talk about. Compared to what? When people say, well, that sounds kind of crazy. Compared to what? The guy that came in the other day on 14 medications? That guy? Compared to that? I mean, so when people say, well, I don't know, that sounds kind of crazy. Do you know right now as a nation, collectively, we have the lowest cholesterol we've ever had. Collectively as a nation, our cholesterol is 199. Yet, we have more heart disease and cardiovascular disease than ever. We're taking more cholesterol drugs, more statin drugs we've ever taken, and we're having more heart disease than ever because it doesn't get to the cause of the problem, folks. Okay? So is there a lot of people that are on a bunch of cholesterol drugs and a bunch of blood pressure drugs that are having heart attacks and dying? You darn right there are. Okay? Absolutely. Matter of fact, way more than you would believe and think. Okay? So for you that says, man, I just don't know what to do. I don't know if I can get better. I don't know. I do not know either. Okay? I don't know either. Meaning I can't look at you and promise you that, oh, if you listen to me, that you're going to heal, right? And that all your, no. But listen. But just because you walk into the hospital and they say, oh, you have inflammation there, we're going to give you this shot and you'll feel better, yada, yada. Be careful, folks. A lot of times when we practice natural type of healthcare, vitalistic type of healthcare, people want us to make a promise to them that no doctor should make you. If any doctor ever looks at you and tells you, I can heal you, this will get you, run. Run from me, run from Dr. Chris, run from anybody. That is just an unsustainable statement. Okay? So you're looking to get to the cause of the problem. The best thing you can do is work with your body, not against it. That always needs to be done through natural vitalistic means, except in emergency situations. I'm not talking about if you drop on the ground right now having a heart attack. Don't misunderstand me. The problem is that's about less than 1% of healthcare. So I'm talking about 99% of the rest of healthcare. People that don't feel good, don't have energy, can't lose weight, have hormone problems, can't get pregnant, can't sleep, can't eat, can't wake up, high blood pressure, all the stuff that you probably think, allergies, asthmas, breathing problems, eczemas, skin problems, I don't care. All that stuff. All the stuff that you listen to this, think about. Cancer, it doesn't matter, okay? It doesn't matter. So I know I tend to go off on tangents, Doc, and I apologize for that, but people need to know that.
And that is exactly why, ladies and gentlemen, that he was on, because that statement, you can't see my physiology, but it made the hairs on my arm stand up. And just the power behind that message, it's so strong, and I hope you just gravitated towards what he was truly saying and how important it is, just like he did years back, how he was able to restore his health. And if that ends up not being you and you end up in that model, the likelihood of you restoring your health optimally, and it's just the chance that you're stacking the cards against you.
Yeah.
And I just really value that input, and that's why I value you so much. And I'm so glad, so appreciative you're able to come on as a guest.
Yeah, absolutely.
So for those who want to get the book or reach out to you, how they do it?
Yeah, probably Facebook is probably the best way to get a hold of me or get a hold of the book. The book's available on Amazon and Kindle. I believe it's the book is it's called Cooperative Wellness, and so a little bit of a play on the word of corporate wellness, which I think has just that term has gotten abused. The old version of corporate wellness was once a year a health fair where somebody comes in and takes your blood pressure and your blood sugar and tells you if you're healthy or not. That's a wildly ineffective way. That's not corporate health. That's not health. And so we said we need to change the game. And so it's this idea of cooperative wellness. And really the term cooperative doesn't mean we all play together and sing songs. It means, that we are understanding that our body is designed to work together. One of the analogies I actually use in the book, is like a soccer team, right? And the better that team is cooperating together, the better outcomes for that team. Does that mean they win every game? Nope. It just means that they're going to have their best shot of having their best performance. Your body is the same way. The cooperation of your body with itself, the organs, tissues, cells, with the nerve system, just simple physiology, the better that's coordinated, the better that's cooperating, the healthier you are. Okay. And so that's just a really important concept. So yeah, you can get a hold of the book that way. I also have a blog by the same name that you can follow. I tend to write about, kind of topical things, whether it's, Tiger Woods, with the recent, prescription drugs. And I try to be as straightforward as I can be, as raw as I can be. If I could talk about something for just a second here, Doc,
yeah.
And this might be a little bit intense for some of your listeners, but I just feel obligated to share it. I would say that the healthcare crisis, you guys, and I'm talking to you specifically as patients, the healthcare crisis that we're having in this country is, and I'm always hesitant when I say this because I don't want it to be misunderstood. I would put it on par with the civil rights. It's the civil rights issue of our day. Okay. And the reason I make that statement, and that, please don't misunderstand me, I'm not comparing it to racial injustice in the sensitivity of it. I'm saying in the impact that it has on millions and millions of lives, it's that catastrophic. Okay. It affects all of us. Okay. Whatever side we're on. If I'm living vitalistically and I'm managing my health, okay, but my child is at school and the child that's next to him is loaded up on dope and decides that he doesn't want to live anymore, but before he's going to take his own life, he wants to take 15 other people's with him. And so he brings a gun to school and he's hopped up on medications and he doesn't care about his life or others anymore because he's not healthy, right? Then that affects us, right? It affects our health premiums. It affects the health of our nation. It affects our GDP. It affects our bottom line. We're spending trillions and trillions of dollars in this country, yet we're having horrible health outcomes. Okay, so it affects us. So we have to get engaged with this, but we have to see it for what it is. Okay, so part of what I wrote in that book, it talks about, you're part of that solution. You're part of that solution. Okay, you engaging in a vitalistic model of care will continue to drive the changes that are necessary in healthcare. We talk about this with food, right? As we begin to make healthier choices, I assure you, if Burger King could turn into a green smoothie restaurant and make the same amount of money, they would do it. They don't care if they sell hamburgers or French fries or green smoothies. They're going to sell what people will eat. Okay, and so we as consumers need to engage in a vitalistic model of care and make those choices, and then we will see the economical pressures behind that change. Okay, so I just want to encourage you, you matter. Your choices matter. Being involved in this, it's not always easy, but it's the right thing to do for you, for your family, and for your community. So it's a big deal. Wellness is sometimes has this foo-foo fluffy, do yoga in the hallway and drink a smoothie. Folks, that isn't wellness. Okay, it's a good idea, and I don't suggest not doing it. But true healthcare is much bigger than that, and it's a big deal. So thanks for the time to say that.
Yeah, no, I appreciate that share, and I love your message and just your passion. It comes through. It's so obvious whenever you talk, and that's why I've listened to you throughout the years, and you're somebody I value very much, so I appreciate you coming on.
Yeah, thank you.
And I'll talk to you soon. We'll look forward to seeing you guys all next week on Health Nuts.
All right, take care.
Take care, Doc.
Bye.
So, you've heard from the experts yourself this episode and have gotten some golden nuggets on health. There is so much more to come and so much more to learn. Head on over to pghcw.com. Again, that's pghcw.com, and sign up for our newsletter where you'll receive free info on how to get and stay healthy. Thanks for listening, and we'll see you next time on Health Nuts with Dr. Chris Carr. Be sure to subscribe to the podcast and please leave a review.